In the United States, it is estimated that pharmaceuticals kill around 100,000 people every year. For certain conditions, however, there may be no alternative to drug therapy, and certain medicines can prolong life, such as drugs used to treat diabetes, heart disease, and cancer. On the other hand, herbal medicines are considered to be a safer alternative and are preferred by a sizable section of the public for treating non-life-threatening conditions. Chidima Iyeka has more on this.
The knowledge of herbal medicine is based on theories, beliefs and experience to different cultures based in the maintenance of health and in the prevention, diagnosis, improved or treatment of physical and mental illness. Conventional medicine is a system in which medical doctors and other healthcare professionals treat symptoms and diseases using drugs, radiation or surgery. However, the efficiency of each have been questioned to date.
Herbal medicine has evolved over the years. Unlike in the past where there's really no content in terms of quality to the herbal medical care, there seems to be some content now. At least a lot of the so-called drugs that are now compounded as herbal drugs now have names. You can easily talk about their ingredients. You can easily talk about the side effects of a few of them. And many major pharmaceutical companies are now buying into the idea of producing some of those herbal medicines.
Many modern drugs are originally extracted from plant sources, even if they are made synthetically. Modern medicine demands standard dosages that tend to vary only with body weight or severity of disease, while herbal healers are more likely to give their patient a unique dosage or combination of medicines that is concocted only during the consultation and based on the patient's symptoms.
This herbal medicine, if na malaria, then go cook am. Then go the person where cook am, where go cook am, he go drink small cup, cover of the snap 3 times a day.
It's more effect, like serious, and it treats a lot of disease. When I have typhoid, if you use the herbs, you can work for it.
Ethnicity was significantly correlated with traditional medicine use, with the Igbo and Hausa ethnic groups less likely to use traditional medicine than their Yoruba counterparts. Other departures from previous research include the finding that education was a significant determinant of the use and that income was not significant. Statistically, 600 women, that is 81.6%, have been reported to take traditional medicine and 135, that is 18.4%, reported not to have ever taken traditional medicine. The reasons for taking traditional medicines were varied, with the most commonly reported reasons being fever with 40% and pal, popularly known as jedi-jedi, with 29%. In the biomedical literature, only a minority reported taking it every day with 14.3%.
For any drug to be licensed for use as a drug, it has to go through what we call clinical trials. And clinical trials has 3 major phases. There is the phase 1, where they just try it on, lower animals. They try it on guinea pigs, on rats, on mice, on geese. Okay. Then phase 2, they now take it a step further. They now try it on monkeys. Okay, monkeys, being that monkeys are seen to be the closest, in terms of genetic makeup and likeness to humans. Most monkeys think like human beings. They behave like human beings. They have similar types of diseases, you understand? So that is what phase 2 clinical trials essentially entails. Then by the time it gets to phase 3, they are already trying it on volunteer humans. Okay? Most herbal medications don't go through any of those clinical trials. Somebody just develops a brainwave and says, okay, this thing, well, let's look at it. When I was young, this was what my father used to, use to treat this condition, to treat that condition. They go after it.
It is important to address differential usage in different ethnic groups, investigate how attitudes and beliefs affect usage rates, and further investigate how traditional medicine usage affects medical treatment. Also, it is essential to communicate the danger of the intake of too much traditional medicines, as it has no dosage and may have negative impact on the body. Chidima Iheka, reporting for KAFTAN TV News.